The Erasmus Medical Center is the largest university hospital in the Netherlands. We are responsible for treating the most critically ill patients that are known in our nation. We are being increasingly confronted with a shortage of healthcare professionals and an increase in healthcare demand. And that will only grow in the next couple of years. So this gap will even broaden. And so now we have to search for solutions and opportunities. So for instance, one of the major challenges and one of the major contributors to having a burnout among physicians is administrative burden. And we believe that investing in data-driven technology and solutions can lower this burden for the physicians and for the nurses. By using data-driven technology and, for instance, AI that could advise us whether it's safe to discharge a patient or not, we save time with the decision-making, and we can spend our time more holding the patient's hand and caring for the patients. And that is where the value of true healthcare is. With SAS Model Ops, we can not only monitor and access models, but we know that they are transparent, explainable, and safe. Because in the end, to fully implement a model at the bedside, you need trust. And that is what we are now currently building. We have to take into account. Working in healthcare means working with patients. We have to make high-stakes decisions in a high-pressure environment. And therefore, we truly value to have key ethical principles in high regard. In our ethical lab, we work together with patients, healthcare providers, and tech providers. And only if we fully grasp this landscape, we can come up with valuable solutions. By investing in AI-based solutions and implementing it at the bedside, we take away this redundant time of administrative workload, and we're now giving back the time. I'm so proud to work with SAS because we both have the same agenda, and that means making the world a better place, and especially in healthcare. And so that when I look into the eye of a patient, I can tell them with all my gut, with everything I have, that what we are doing is safe and beneficial. We are also a mechanical ventilation expertise center in the Netherlands, meaning that we often treat the most critically ill patients, but also the most complex patients of the nation. Because we are a mechanical ventilation center, you actually need real insights. So actually there's a true need to work with AI-based solutions. What we now developed is a mechanical ventilation dashboard, which provided us with real-time data insights. So we developed this dashboard and we implemented, and the results were actually truly impressive. We noticed that the patients that were treated with optimal mechanical ventilation settings doubled when both nurses and clinicians took these real data-driven insights into account when they were making treatment plans. And it is exactly how model ops, but also just data governance and real-time data insights helps us to improve healthcare.